some modalities that we use in the clinic. A lot of these things help with pain control, tightness in your soft tissues like your muscles and your fascia, bruising and swelling. So one of them that we use is ultrasound. And what it does is it sends sound waves through the sound head into your skin. It can get deeper. If we use a deep heat treatment, then it can get deeper than something like a hot pack. It can get up to about 5 centimeters deep. So if we're working with a lot of muscle tissue, it can help with that. Whereas a hot pack only gets about half a centimeter. And so what we use is some ultrasound gel. And this isn't a diagnostic tool. There's no imaging that comes up on here. It's just for treatment. And we would have it on whatever setting for whatever our goal is, and we just use it in a small area, only about 2 times the size of the sound head. And we just use circular motions to treat the area. And again, it depends on the setting. This can help with bruising or swelling. It can also help with pain and decreasing muscle tissue. And this usually lasts about 5 to 8 minutes for the whole treatment session. Another thing that we can use is electrical E-stim, which you can use either the 10 setting, which is for pain. We can also use a Russian or a neuromuscular re-education setting, which will help with retraining your muscles to perform correctly. It'll cause muscle contractions. But typically we use it for pain, and these are just sticky pads that attach to the lead wires, and we attach the pads to wherever the painful site is, and we turn it on to the patient's comfort level, and it's just a small tingling sensation. And lots of times we'll add a hot pack or a cold pack with it, just to kind of help with pain relief. And that'll also last about 10 minutes. And what that does, too, is it helps your nervous system release endorphins, which is your body's natural painkiller. And the endorphins will stay in your bloodstream for a couple hours, so the pain relief will last after you go home. Another treatment that we have is a class 4 laser. It looks similar to the ultrasound, and it also has different settings on it that can help with pain, inflammation, stiffness of joints, such as pain from osteoarthritis or also for muscle pain. And it just has a little laser head on it. And this we actually hold in one place and apply the laser for about a minute to a minute and a half, depending on what we're trying to achieve. And we just get the local treatment area of whatever the patient's pain complaint is. And all of these things we couple with exercise and with manual treatments to help with soft tissue issues, pain, inflammation, swelling. It'll help you get back to a quicker recovery.